Good afternoon, good day, everybody. Welcome to Dental Voice Season 2 with Zyris. My name is Rolando Mia, and today we have Michelle Strange, RDH, returning and spending some time with us. I especially like every time we have an
Aw.
opportunity to speak to her because a couple things. First of all, the passion that she has in understanding this, the fact that forever she's been a supporter and advocate for effective and proper infection control. Plus, as a natural researcher, she's naturally curious and she's incredibly knowledgeable about things. So I'm really excited to kind of get her perspective and so that she can share. It's been, what is it, Michelle, 4 or 5 months now since we last talked? Isn't that crazy?
Wow. Yeah, no, that is crazy. I'm getting feedback. I'm not sure from where, if it's on my end, but I thank you very much for inviting me back on here. The 4 months has it. I feel like everything has changed and nothing has changed. Like I'm still at home. I'm still at home.
Right.
Still doing a lot of webinars and a lot of video conferencing and a lot of chatting with people via the webcam. But at the same time, we're not quarantined anymore. We are kind of slowly getting back, depending on where you are in the country, and what your office protocols are. It looks very different for a lot of people.
So, first of all, thank you for joining. And I want to jump in and I need permission here. Is it okay if I get a little nerdy on you here? Because you
Always
mentioned,
okay.
I've seen that
Always.
you're a dental nerd and I want to understand a couple things. So, starting out, when we last talked, you gave us a really wonderful education around what you've been passionate about and you've been screaming at the top of the mountains. And now all of a sudden, people are paying attention. When you look and consider the last 4.5, 5 months, from your perspective, with regard to these, considerations for modes of transmission, what has changed and what hasn't from based on what you've seen?
For me, it's the hierarchy of controls and breaking the chain are everything. Like that, I've never talked so much about either one of those topics. When I give courses, I would always be like, okay, here's the route of transmission. This is how you break the chain of infection. You have your reservoirs, you have your, all the different portals of entry, portals of exits, and the modes of transport and transmission. And, I think what we're all learning is that environmental infection control is so super important that we really need to be mindful of our disinfecting wipes, because we don't want to have fomites and have because we touch a lot of things in our industry with our gloves, but now we're struggling getting disinfecting wipes. And it's like, oh my gosh, we're all freaking out. First it was mask. Now we can't seem to get disinfectants. And I'm seeing some things of people going to like Home Depot and Target and grabbing stuff. So I would definitely say, in regards to modes of transmission, we still have to, from an environmental infection control standpoint, follow the CDC guidelines. They need to have an EPA registration number. They need to be hospital grade. They need to have a tuberculocidal claim. Like, let's not forget how important that is. And then, from a hierarchy of controls, I think we're all really understanding our engineering controls and how important those are. And honestly, I've read research that it's still droplets when we talk COVID. I've read that it's possibly aerosols now. And I don't know if we'll have an exact.
Right.
We don't know just yet. And it might be different for everyone depending on their viral load, honestly. But what I know is that if we follow the hierarchy of controls and we understand where we can break the chain, as many places that we can break that chain, we're going to be all right. We'll be all right.
So you mentioned fomites. How big a deal really is that? Is it true that inanimate objects can actually transmit COVID? I mean, specific to COVID and this whole pandemic. is it really that crazy where, I could sit here and, I don't know, drink from a fountain and then somebody could get it from me? Is it really that crazy or not?
I don't know. I don't think we actually have a definitive answer, at least nothing that I have read. And I think it's also going to be more of like, am I straight COVID symptomatic patient and I cough, sneeze on your water fountain and then you come behind me? Or am I an asymptomatic person? There's just a lot of variables, as there is for everything, even when we are like looking at bloodborne pathogens.
Right.
If I have a patient that has HIV and they are on all their medications and they're doing all the things they need to, I'm not worried at all about seeing them. Am I worried about the person who has not been diagnosed, has not seen a doctor yet, all those things, and I get stuck? 100%. So I think that it's going to be a same feeling, and not just with COVID, but dang, the flu and chicken pox and the cold. And I mean, tuberculosis is still a thing in our country. So,
Right.
there's a lot of, I think we're really starting to wrap our head around airborne precautions and what that looks like. And at the end of the day, we still need to be doing our 2-step disinfecting of all of our units and barrier wrapping where we can so we don't have fomites.
See, and it's interesting, as often as we see these articles or discussions about the different modes, the hard substance surfaces, droplets, all of a sudden now you're seeing a lot about aerosols again, because they're starting to discover, hey, wait a minute, there may actually be proof that COVID sits in these. It still boils down to, if I'm hearing correctly from you, there's following the standard protocol. We've heard, or at least thankfully, the number of cases in dental practices is not anywhere near what you were hearing, that it was going to be the vector of all ages because of the aerosolization and all the instruments that generate that. Are you seeing the same thing, and do you believe that it's not going to ever, or it's going to stay really, really low?
I think it's going to stay low, but I think there's also a lot of variables that go with that. Like, we aren't a vector yet. One, a lot of us aren't going back to full on aerosol production. Hygienists aren't all using their ultrasonics. We upped our game with our respirators. We got double masks. We got all the PPE. I mean, we're bundled up. And, I think it's also depending on where you are in the country. Like, Charleston became a dang hotspot after you and I talked. I'm like, because everybody's with all their foolery out there going to the bars without masks. So we became a hotspot. So my clinic was shut down still now. We have not opened up since March because we were such a hotspot. So I think there's a lot of variables. And I know this might be a little provocative, but there's a lot of people not reporting it. And so, and that's from an anecdotal Facebook scrolling, trolling social media of people like, my doctor just came in and now he's showing full signs of COVID and has been trying to hide it. Like, that's happening. And I hate to say it, but it's happening. So I don't know if we'll ever really know if we're a true vector or not, but also we were doing a lot of the right things to prevent that. And I think that's been huge for us. Now we just got to make sure that we're not, like, it's invisible, so we get a little lax sometimes. Like,
you kind of forget about it.
Still have to take into account a lot of what you're doing and how the ways that we can protect ourselves and our patients.
So you mentioned ultrasonics. That's a big topic that we've been hearing a lot about, and there seem to be two sides of that argument where I'm not going to use it because, and then there's also the side which is, what, my patients really care. I can't get the same level of care without it. So I'm going to put things in place to use it. What kind of, how would you categorize where you sit with regard where on that fence you sit, use them or not?
So I feel like the ultrasonic debate, the hand scaling debate, is very narrow-minded. And I'm going to be a little maybe controversial.
You never have, right?
I know. I'm like, oh. So I really feel like it's super important. Like, I'll get to when we need to use it. But first and foremost, Why did we not take this opportunity to drive into our patients' skulls home care? The importance of maintaining biofilm at home between appointments, using teledentistry, using our words to describe the brushing techniques, sending out letters, sending out text messages, how critical it is to decrease inflammation in your mouth. I mean, some people might have done it, but I feel like we missed a really amazing opportunity to drive home how important prevention truly is. Because honestly, once you put an ultrasonic or need a scalar, disease has already occurred. Buildup has already occurred. That's not prevention. So my thing is, I understand people who say my patient's mouths are important. That's why I'm going to use an ultrasonic. I get that. But your biofilm management with the ultrasonic in this one moment, like, what is that? That's a drop in the bucket when we could have been really beefing up people's home care. Really doing like these FaceTimes. Like, we were allowed to FaceTime and Zoom and do all these things with our patients during COVID and quarantine. Like, we got the green light, and gosh, I wish we could have like embraced that.
Yeah.
But let's say you have a patient sitting in your chair. They do need the ultrasonic. They do need the lavage. They do need the breaking up that deep calculus. I use the ultrasonic, but I've talked about this with you before, Rolando. I love airflow. I am biofilm management, creating aerosols, spatter spray. Like, I love it. Going back to hand scaling is a nightmare for me, like a true nightmare for me. I don't want to pick up a scalar ever again. I want to do biofilm management in the most least invasive way, and that's home care, and that's airflow with erythritol, and then pick up the scalar if I need, or ultrasonic if I need to. So for me to pick up that ultrasonic, disease has already had to occur. I didn't prevent it. I didn't guide my patient. I didn't coach my patient. I didn't meet them where they're at. I didn't do the motivational interviewing, whatever it takes to get them involved. But if I need to pick up that ultrasonic, I'm still going to hold true to my hierarchy of controls. I'm going to eliminate. I'm going to substitute if needed. If they have signs and symptoms, they're not coming and sitting in my chair. If they've traveled, they're not sitting in my chair. If they have anybody exposed of like 2 degrees of them, they're not coming to sit in my chair. I'm going to use my engineering controls. I'm going to have my air filters. I'm going to have my continuous suction. I'm going to have all these things in place. And then when I need to use that ultrasonic, I'm going to make sure I have great work practice controls, because I'm going to have good technique. I'm going to make sure I use all the things that are going to keep me and my patient safe. And then I'll have the proper PPE. And then I feel confident using it if I follow those hierarchy of controls. So that was a really long answer to a simple question, I feel like.
No, let me reflect, just so you know. I heard it is necessary. And to get there means something wasn't done. And that's the education, and it's the care at home. But there's the other side, which is new patients are coming in that you had no ability to affect, and they had poor hygiene, they had poor things. So there are going to be situations when you have to use it. But when you use it, do it correctly, follow the protocols, and make sure that you're protecting yourself, your patient, those around you. Did I catch that?
Yeah, exactly. Our hierarchy of controls are they're built for this. Between our standard precautions with our transmission-based precautions and our hierarchy of controls, I mean, we have the tools available to keep ourselves and our patients safe. We just got to use it.
Yeah, I love that. Now, you mentioned something. Thank you for that, by the way, and really appreciate you did answer the question, and the way you answered it was very, was spot on, because it depends, but your depends was definitive, which is good. So you mentioned something, and this has to do with it's systemic health, and I'm gonna periodontal disease, which is so prevalent in society, and so many people suffer from that, and end of the day, very little is very recently, and I'm curious to get your perspective on this. what we've been seeing, there have been some things or things being published that show that periodontal disease or oral health is clearly tied to systemic health. But when it comes to COVID, as we get more cases, as we get more information, as more science, and we're monitoring things, there seems to be a correlation between when people have been compromised systemically. A lot of times, it can be coming from the mouth, and there's this correlation of periodontal health or oral health to systemic health, which also ties back to how badly COVID will hit you. Have you thought about that? And then the fact that, what is it, inflammatory IL-6?
Yeah, your interleukin 6.
Yeah. There seems to be a connection between severe or bad, poor oral health, periodontal, and that. What are your thoughts on that? And how do you see COVID, the severity of how badly people get hit, because it's just a matter of time, and then systemic health and oral health?
I definitely saw that come out with the interleukin 6, and I read it and how gum disease, periodontal disease could make your chance of having, not being able to fight COVID as well because of the chronic inflammation. And I read it and I was like, yeah, duh. Like, I mean, it makes complete sense, because this is what we've been saying for years. Like, take us serious, because we're trying to control this chronic inflammation. And if we can't control it, like, we know chronic inflammation anywhere in the body is not okay, and now we're looking at gut health and all the things constantly. Like, I read it about interleukin 6 and I was like, yeah, the cytokines, like the cytokine storm. Like, yeah, it makes so much sense. And it just really drives home how important we are.
I totally hear that. See, I was thinking, and I've been talking with and I forget somebody, and I want to get your perspective on this. That there's this whole, dentistry seems to be the thing that everybody points to. Oh, it's because you didn't get effective health. Dentistry, or hygienists and dentists, don't just clean your teeth. They don't just give you a wonderful smile. If anything, they are the key point to establishing and maintaining systemic health in a person. But people ignore that. Why do you think that happens? Why? Is it because we just ignore our mouths?
So I think there's so many factors. And honestly, if you guys really want to delve into the root cause of a lot of separation between medical and dental, I would highly encourage you to read the book Teeth by Mary Otto. So good. Teeth by Mary Otto. She was a Washington journalist. I think it was Washington Post journalist. Don't quote me on that, but she saw back in Baltimore, with a little boy died from being septic from a toothache and an abscess, and she started looking into it, and like, why are we separated? Why couldn't Medicaid see this or they're on Medicaid? Why couldn't they do it?
Didn't see the connection.
And so, we really kind of painted ourselves into a corner in a way, not to hate on dentistry, because I love my profession, but we kind of did it to ourselves a little bit. We've called it a cleaning for years, and really, it's time to elevate what we do. It really is. Like, what are we doing for these people? We are maintaining disease that, we're managing a medical disease with oral manifestations, honestly. And I think that that's something that we really need to speak to. And, when I see my patients, the first thing I do is, it's probably a solid 5 to 10 minutes of talking with them. I'm talking about sleep. I'm talking about their airway. I'm talking about nutrition. I'm talking about what's happening in their mouth and how it's connected to everything. And man, like, they are just like a sponge with it. Like, the moment they hear, I'm like, yeah, have you, thought about your diabetes affecting your mouth, or your mouth affecting your diabetes? And I don't know. It's just like a light bulb goes off and they're like, wow, yeah, I get it. So they're not coming in for a cleaning. They're not coming in for that. And it's changed everything to have that conversation with patients. But I'm only one person seeing one patient every hour. So we all have to elevate what we're doing and how important it is. And I think we're doing that. I think we're seeing the shift in dentistry to, managers of chronic disease. And I'm not 100% on this, but I think periodontal disease is still the top 5 chronic disease, inflammatory diseases of the world.
There are so many. Yes,
Yeah.
I've seen that. There are so many people who don't even realize it. As a matter of fact, one of our friends in the office said that his brother or friend, actually, the only time that he got sick was because of an abscess in his tooth, went into his blood, into his heart, and he became incredibly
Septic.
sick.
Yeah.
Yeah, think about that. Yeah, and I like the context. First of all, it only takes one person to change the world, but it takes time. So
Yeah.
getting a message out, I believe, is important. And the I think COVID definitely has brought that in because especially aerosols, you're seeing a lot of people. You're seeing people with massive hoods. You're seeing people with all sorts of things, and the context of airflow is
Yeah.
it. I think it's been reinforced now that the more and um, there still isn't anything really definitive. Or have you seen anything definitive with regard to how much or how often it needs to be? Have you?
As far as the airflow in the office,
Yeah, and in the treatment area, the office, in the
I don't quote me, but I think it's 12 to 16 air exchanges an hour.
the more the better.
The more the better. The more the better, 100%.
None is not.
But it's in
None is not.
conjunction with your other engineering controls, like your high volume evacuation. Like it's a combination. We can't just again, we relied on our PPE to carry the weight of a lot of our protection, and we can't look at these engineering controls like the airflow, our air exchange, like looking at our HVAC, all that. We have to look at a lot of things: our vacuum system, our high volume tips, our our air filtration in the operatories. There's a lot that we have to really consider and think about, and not
Yeah,
just letting one thing do the job for us.
yeah, I'm learning, and as I speak to lots of the clinicians, experts out there, there is not a single silver bullet.
No.
It's actually a process of layering. It's
Yes.
consistency, right? And maintaining it. You mentioned after a while you kind of forget, so you kind of take things for granted, and then
Yep.
all of a sudden, until something happens, and then all of a sudden you kind of freak, and you're like, "Holy cow!" How would you speak to the hygienists out there today who still are feeling apprehensive to come into the office, who are still, having the angst or the anxiety of feeling exposed? Because as much as I've heard a lot of offices opening and teams coming back, there is
Mhm.
just as many who aren't. Well, kind of
Yeah.
what's the message you want to tell those folks, or how can we help them?
Mm. Well, I really think uh, so. I wrote an article recently. I think it's out in Peri Implant Advisory. God, I can't keep track of them all now, but I think it's in Peri Implant Advisory. And I was talking about creating a safety culture in your practice. And I honestly think that that's what is holding people back. Maybe they have some anxieties about their home life. Maybe they have some anxieties about people that they're caring for. God, if they get it, then I mean, they're the breadwinner. They're caring for their parents. They themselves are, possibly going to get it, and maybe they have their own comorbidities that they have to be concerned about. I'll be very frank. I think a lot of anxieties came from maybe some bad behaviors prior to COVID. You know, so I've worked with offices before, or in an office where we would have a dental person that would just go and reach their bare hands into the ultrasonic and pull the instruments out, or you'd walk into a room and you'd see blood, and you're like, who's wiping these rooms down? And so I think if the office has a true culture around safety, and if it wasn't prior, you're getting it now. Like, you're showing the steps that you're taking to truly make sure that the patients are safe, the team is safe. And I think that that's huge. The one thing I would say to hygienists is that don't let past experiences ruin you for now, right? Like, so if your doctor maybe didn't have the best protocols, or maybe some team members didn't have some protocols, and they're truly making the effort, give them the chance. You have to go back, you have to work as a team, and you really have to be like, okay, maybe they learned. Maybe we're going to make some changes. Have faith in it and be a part of it. If that's not happening and everyone's just going back to normal, I heard something the other day where someone's like, yeah, we have to ask the doctor to wear a mask. And I was like,
What?
What? What? And I was like, okay, maybe that's not your office. Maybe that's not your office. Maybe there's some other things. But also, if you're like truly, truly upset, truly scared, you can't leave, let's talk teledentistry. Let's get creative. Let's get innovative. Let's find some ways to use that OHI code and some teledentistry codes, and let's talk to our patients as much as we can. I mean, it's not going to happen overnight. It's not going to be super easy, but create your own path. Find a way to utilize this software. The fact that I'm seeing you right now in California and South Carolina, like, let's use this. And you know so much. It's super valuable. You're worthy of like coming back and seeing your patients. So please don't just drop it, but get creative, get innovative, meet your doctors where they're at. If they're truly trying and trying to make you safe and the team safe, meet them where they're at. I've heard some horror stories on the dental hygiene side where they're like, I want hazard paid. I want this. I want that. I'm like, y'all need to take it down a notch. These people have not been making money. Like, give it a rest. But truly meet people where they're at, and maybe do some soul searching about if that's the right practice for you, if you're feeling that it's not right. But I think we can do it. We can come back. We can be super safe. We have, again, standard precautions, transmission-based precautions, hierarchies of control, and we know how to break the chain. We are so good if we do all of those things. We're totally fine. And I truly believe that. I have faith.
And for those, so here's the thing too. I've also discovered when you're looking at hierarchy control of controls, when you look at the different technology behind it, not everyone knows about those. So there's a gap. There's a gap in the understanding, and I don't believe it's an issue of the person. Maybe it's an exposure issue. Maybe it's not been on the radar because of a focus elsewhere. How can people quickly get that kind of understanding, nerd out, as you've phrased it, dental nerd out, to understand what those mean? Because as I'll ask you, if you were asking the dental teams, even some of the doctors, and you ask, define for me what those hierarchy controls are and how you break the chain, how many of them do you believe would be able to actually articulate that in a meaningful way to you, so that you would say, okay, he, she, they get it, or, oh, okay, not quite?
Well, I think the number is higher now because everybody went on
definitely higher.
They went
now.
hyper focused on infection prevention. So that I think the number is higher. But 50%. I don't think it's.
Yeah, right.
I think it's half. I think it would be half the people, honestly.
So where can people find that in an easy way, and not just, hey, Google it, go watch a YouTube, because there's just so much crap out there, quite frankly.
Yeah.
I've been looking and I'm thinking to myself, my goodness. And some of it, and not to poke, I aged thousands of years just watching a 10-minute presentation.
Yeah, some of them are not fun.
And I'm not trying to poke. And when you can push through that, you're like, wow, this is really meaningful. But where would you tell people to find that? How do you find that information?
So I'm gonna kind of do a little self-promotion here, Rolando. I was on a task force with OSAP and DentaQuest. There is a living document. If you go to osap.org, or if you go to atailoredtohygienist.com, under the resource tab, we have that living document. So every time there's a CDC change, they're updating it. They give a great explanation of the hierarchy of controls and the engineering controls and practical tips, really. Like, I was really happy to be on that task force because I learned a lot from some of the greats out there, like John Molinari, and now I'm blanking on all the names, but so many amazing ones, Kathy Eklund, everybody. And then subscribe to the Level Up Infection Prevention podcast and go to Level Up IP. That's my company, Level Up Infection Prevention, where we are creating those documents for the infection control coordinator so that we know it's intense. We know it's overwhelming. It's not fun to be in the trenches seeing patients day in, day out. You got to go learn about interleukin 1 and 6. Like, go learn about the, C-reactive proteins. Those are what's going to really change your patient. And then let the ICC, the infection control coordinator, manage the safety of the practice. And then we'll hold the hand of the ICC so even they can go and focus on their other jobs that they need to be doing. So there are great resources. Again, levelupip.com or osap.org is a fantastic one.
No, and I appreciate that, and I knew that you do that, but there are also a lot out there where it's just a jumble of things, and what's important is the information needs to be relevant. It needs to be now, not something that's 40, 50 years old, that type of stuff. So I very, very, very much appreciate that, and really appreciate you mentioning that. I feel that it's important for people to recognize the where we were 6 months ago, we're never going to be again. Would you agree?
And thank goodness. Thank goodness. Like, I feel like, yes, absolutely. There's a lot of parallels to what happened with bloodborne pathogens, right? When we discovered hepatitis B and HIV were an issue for us. And, can you imagine going back to no gloves? And I just, oh, good. Like, no. And I feel like we are getting there for airborne precautions and airborne pathogens. And we needed to be there. We needed to be there for the last decade or more. So I'm glad that we're not going to go back to that 6 months ago. I think we've learned a lot, and now we're safer. We're going to be safer for it. We are. I think we've understood. And even just to go back to our conversation that we had at OSAP, we talked about the importance of high volume evacuation. We're talking about checking your vacuum system. Can you even run it? Is it 45 years old? Is it time for an upgrade? Like, we have needed to talk about that for a very long time now. And we are. And we have options, and we have research that's not 45 years old. Like you said, like, it's relevant, it's current. We did not have that because I've been in that aerosol world looking for it for a while, and it just wasn't there. Now we do. Now we have this discussion. And I would just even like to say, I know this is a slight digression, but to go back to our conversation about the chronic inflammation in the mouth and how important we are, we really have to understand comorbidities. And they're not the obvious heart disease, diabetes. We have a lot of other things that we could really make a change in our patients and a difference in their lives by just talking about vitamin D and airway health and sleep apnea and all the vitamins and the deficiencies of the American diet and how important their teeth is. I mean, Uche Odiatu says we maintain the chewing apparatus of, nutrition is nothing unless we help maintain the teeth, right? Like then they're just on soft diets. And we are the first thing that happens for nutrition, or like we maintain the thing that happens for nutrition. So I don't even think I said that right, but you get what I'm saying. I think that we are really starting to see how important we are, how important the conversations we have with our patients from a health standpoint, and how important airborne pathogen control is. And I'm here for it. I'm ready. I've been ready for a while.
and that's so. Thank you. I love that. I love the feeling, because what I'm getting out of it is this: don't just do something because you're told. Understand why. Understand why. Understand the underpinnings, because all of a sudden now, simply doing this versus doing this, and you're like, why? And that's what I'm hearing you advocate. Don't just go learn for the sake of learning. Understand why. And I love that message. I think that's pretty cool.
And learn as a team.
Yeah, there you go.
Please learn as a team.
That is so awesome. Hey, if people wanted to reach out to you, what would be the best way to do that?
So there's quite a few ways. Either MichelleStrangeRDH.com, a tale of two hygienist.com. That's with an S. That's my podcast. And you can also find me at levelupip.com. So lots of different ways.
Well, first of all, I for one am absolutely just so happy that not only do you continue to have the passion for this, but you're not going to say no. You're not going to take a step back, and you're constantly pushing. Well done to you, and
Thank you.
I admire that. It's huge, and we need more people like you. And when it comes to dentistry, it continues to be one of the best professions, and I think we're finally getting a much better perspective. And I appreciate the sentiment and your messages. So thank you for that. Really appreciate
Thank you. I appreciate inviting me on here and telling the world, teaching us things. This is great.
Awesome. So at some point here, would you be willing to come back? And another 4 months from now, I'd be curious to see what's going on and talk about whatever's next. Is that cool?
What will?
No?
What? No. I'm like, whew, I'm just like thinking, what will happen in the next 4? I keep saying like every week is insanely different, but also exactly the same. And I don't know how to process it. So I'm hoping 4 months from now, we got some more information, some more evidence, some more research, and maybe we're on the downhill of this pandemic.
Yeah, but anyway, so thank you so much. Thank you for your words. Folks, if you like this, please share it. The information that Michelle has and all of the resources that she has, I've personally been there, and it's an incredible body of knowledge, and it's very informative. Again, understand why, don't just do, because then you're kind of going through the motions, and we all want to understand why, and that message came very clearly and very strongly. So thank you, Michelle Strange. It's been an absolute pleasure. Look forward to seeing you again. Please be safe. And later on, I'm going to drag you back here and we're going to nerd out some more.
Love it. I would love it.
All right. Thank you so much. Have a great Labor Day. We'll talk to you soon.
Bye, everyone.